Good morning. We've got the lovely Ros this morning. I'm going to let you explain what your profession was, what you're retired as, rather than me explain it and totally muck it up. But Ros is a retired medical professional. Is that right? That's the right terminology.
Well, I'm not a qualified nurse. I was what we classed as, especially in North Lanarkshire, as a clinical support worker. And then I moved to Forth Valley as a phlebotomist. And
Right.
I've done that through COVID and
Right.
worked with that through COVID.
That is a profession. So you're a
But,
retired phlebotomist,
Phlebotomist,
which is
yes.
what I've said before on my story. So I just
Yeah.
wanted to make sure I'd got that right. So Ros is not an Instagrammer, so I won't be doing this as a collaboration. I'm doing this purely as a really hot topic, really. Women's issues and hormones is a hot topic. When I put my box up on my stories asking people what they'd like to see conversations on, I had loads about women's issues, and it was loads of a massive spectrum. So I'll be doing more of this, but this for today is really come about initially because of my issues, and that's how you and I got talking. So you are on Instagram. You're not an Instagrammer. We're not doing it as a collaboration, but I will tag you when I post it so that people know who you are.
No
So the reason I started chatting to Ros was because way back, a lot of you will remember that I was experiencing really bad hair loss. Now, I've had COVID a couple of times at least, maybe more. I've had it twice, definitely. And I do believe that it can be as a side effect of COVID, apparently, although it's no official, but there's so much about COVID that's no official because it's new to all of us. So I'm aware of that, but being 48, I'm also hugely aware that I'm entering perimenopause stage, you know, and I thought it might be down to that. Now, as everybody also knows that follows me on Instagram, I've got a coil fitted, so it's harder for me to know if I've got symptoms of perimenopause because the coil, you can take a period on it, sometimes you don't. And I went for a phase last year for 6 months where I didn't take a period on it, and of course I'm thinking, well, I'm perimenopausal then. So I just assumed that I was, but the thing that bothered me most, I had no other symptoms. I don't get night sweats. Apart from like feeling old, which you know, I don't know if that's connected, but other than my hair, I'd becoming really, really thin, and it was really getting me down. I have no other side effects. So, but because it was getting me down so much, I phoned the doctor, and it was a phone appointment, and he said, you know, you probably are perimenopausal. I can't see it being anything else. He said, but we'll do blood tests anyway. And so they did the blood tests, and I had to phone for the blood tests, and the receptionist said to me, everything's fine, there's no issues, end of story. Now, that is how
Ros
that's how Ros came into the conversation, because I then came on here and I'm like, what now? What happens now? Or during that whole process, when I was talking about it, you then came into my inbox and said, listen, you can actually, you're well within your rights to ask for another chat with the doctor and a copy of your blood results. So that's what I did. Now, it's really important to say that this isn't throwing stones at the NHS at all. It's just a point of saying you are allowed to push it further if you feel that you should, and you'll never be knocked back, because that's
you're not even pushing it forward. You're just asking for your rights, that now you need to really take on the NHS as it is, which is a fantastic organisation, but like everything else that's going on, and before COVID and through COVID, it's now at a stage where a lot of the responsibility has to come from us as well. That's what I have seen more than, and that's what I wanted for you, because you actually came back and said,
come forward a wee bit, you keep going back.
You actually came back and went, oh, I don't even know what they're taking bloods for.
I know, I didn't.
I'm like, so why do you not know what bloods your doctor is taking from you on your health? And that has become, I've seen before I retired, I just seen patients coming in at me on their knees, whether it was through COVID or whether it's through whatever. I had no idea. They're saying to me, what are these bloods for, hen? What am I getting these bloods taken for? And I'm like, you don't know? Like, I'm just there to take the bloods. I'm the phlebotomist. I'm not your doctor. I don't know medical. I'm not even a registered nurse or anything else. I just have an idea of what bloods you're getting taken. But as the patient, you now need to be aware of what is happening to you.
And I didn't know. I just, you put your trust into them. You just go, right, no bother, take my bloods. I didn't know. And when you said to me, what are they testing for? I was like, I don't actually know. But then I did find out because you said that. I'm like, I better find out. So those first results came back with a borderline underactive thyroid, which the doctor, after a conversation with the doctor, that I pushed for, take it back a step. So the receptionist said, everything's fine. And I'm like, where do I go for here? And you had said, we'll go back and ask the doctor if there was anything borderline. You said that if there's anything borderline and, you know, what's available.
Your age. I was going with your age and what you were kind of saying, symptoms, perimenopausal. I'm like, these could all be borderline and nothing could be done. But
so I've learned so much since all of this. I've learned so much because you pushed me to find out what it was. So when they said everything's fine, ask for another appointment with the doctor, and I said to him, look, the tests have came back, everything's fine. Is there anything borderline? I'm really, really upset about this, and if the NHS cannot do anything else, that's fine. Just let me know, and I know that I need to go elsewhere, and it's going to be private. But at least it's my responsibility to do something about it. And I did ask for a copy of my blood results, and that first time I got them, no problem. You're entitled to a copy of your blood results. So if you're thinking about going somewhere because you've got any kind of hormonal or issue in your body, you are entitled to your blood results. Now, what the doctor said at that point was, I think we'll do some more checks, and I can't even mind what they are, but I have got my blood results to show you. He said, we'll do some more checks, and again, that came back normal, and the receptionist said it was normal. Now, at that point, I didn't and haven't pushed for another doctor's appointment, although I know that I could, but I did get a copy of my blood results the second time as well, because I still hadn't decided how I was taking it forward. However, it's worth saying, in the meantime, I was recommended a supplement for my hair, the Meggie Wellness. Is it Meggie? I'm sure it is. Meggie Wellness Hair Growth Supplement. I'll put it in the comments when I post this, because everybody always asks me about it. It's like 20 quid a bottle for 60 out of Amazon. You take 2 for the first week a day, and then it's 1 a day thereafter. I'm on my 3rd bottle, and it's made a massive difference to my hair. So that is why I haven't pushed it. But it generated, when I was talking about it in my stories, loads and loads of conversation about hormones and perimenopause and going to the doctor, and people feeling like when the receptionist says it's all clear that there's nowhere to go. They're not, receptionists are not qualified to give you advice on where to go anyway, and that's why it's so important, as you say, Ros, we need to take responsibility and ask.
Also take from what the receptionist is there, and I know probably whatever amount of yous are out there will be thinking, but they're pure bitches. I get that. I work with them. I've worked in surgeries. I get that. These women,
they're
girls,
not all like that in their defence, but it is quite difficult when you phone sometimes.
I have not come up against that, but I know it. And I know family members that have come up against that. And I have said, and I'm going to give you a wee bit of advice on that as well, like just to take on that as well. Because at the end of the day, like us all, you're going in there with possibly not knowing what's wrong, not knowing what's going on with you. So you're going in with a bit of a maybe mental health, or you're low in any way, these girls that are actually working in amongst that are probably feeling the same way as what you're feeling. They're probably the same age. They have been told by doctors. They don't make this up themselves. And I know we always have, well, what do I need to tell her for, because she's just the receptionist. But again, we are now at a stage with the NHS or with doctor surgeries that we do need to have a better attitude about that. I get, no, you don't need to take any not nice, eyes rolled, any huffing and puffing or anything else. No, that is not on, or any attitude. What you can do, and I kind of emphasise on this, what you can do with that, if you have that feeling, because you're already going in there feeling maybe not anxious about going into a doctor's. There's not everybody that is open about doctors. We've got an old-fashioned view about doctors that, you know, well, they were always a wee bit like God and a wee bit above us, but they're not, and neither's these people. But just say in the nicest possible way, with all due respect, I'm not understanding, or I'm not getting from you what I want to get. Ask either for another receptionist or bypass that. No, you're not going to get to speak to a doctor that day, but say, could you please arrange for it? It's probably not going to be a face-to-face, but there's every chance a doctor will speak to you at some point on the phone.
My appointments have been phone, and that doesn't bother me. I just want to speak to a doctor. I don't care. I'm actually quite happy if they keep it like that you don't need to go in and it's a phone call.
To be fair, I think that too, and I think that's going to be the way forward, and that doctor will then tell you that, no, I want to see you. I was at the doctor's last week myself for bloods. I told the doctor what I wanted done because I knew, not a problem, they know me. Right, Roslyn, that's not a problem, you can get that done, and I want to see you face to face. And I'm saying to them, no, look, honestly, I don't need a face to face. I don't go to the doctors. I did go because she was like, no, I want to see you and have to go back in a month's time for something that I'm getting checked. But so I get that. And also the other thing I want to say as well is, even if you go to that doctor, there's no such thing now as a personal doctor. Right, there's not a person.
It's not.
We all used to have.
Back in the day, everybody's doctor was somebody that they would say, "Oh, my doctor,"
and it was a family doctor, and your mother or your granny or whoever all went to that doctor. That's what happened in Glasgow. We all had the same doctor in Duke Street for hundreds of years until we moved.
I used to work
to Cumbernauld.
Duke Street.
All right.
At the very, very, very end of Duke Street,
the
big one up next to the
doctors
forge.
Yes, that's where our doctors used to be all the many moons ago, and that was our family doctor. Right, you've seen, right, go down to dog. It's not like that now.
No, you can't. The relationship's different anyway.
Totally different.
So going back to the whole menopause thing, and I did speak to the doctor about menopause. That second lot of, this is where I learned so much as well, that second lot of blood tests came back saying, now the doctor asked for menopause hormones to be checked, and it came back saying, because of my age, there's a certain process that they follow for checking for menopause, and because I'm 48, they don't even test me for it. The way that menopause is diagnosed at my age is taking into account all the symptoms. So if I was to say I'm getting hot flushes, I'm feeling really weak and tired, and my bones are aching, and all that, you can Google it, all the symptoms that come with menopause, that is how a doctor would diagnose me with perimenopause. That's how they do it at my age. They don't do hormone tests because your hormones apparently are fluctuating at my age so much that a test doesn't verify it. So I learned that. So I'm now kind of really aware of my body because I'm 48. The average age in the UK of menopause is 51. So I'm trying to be self-aware on my own if I'm perimenopausal or not, because I've realised that the doctor can't tell me anything that I don't know.
You don't know,
when it comes
because
to
your body is telling you. Right? You can go, a GP is what it stands for. It's a general practitioner. He has general knowledge of everything. In my day, again, being that, and I had a hysterectomy, so my menopause actually hit when I lost my mum 20 years ago. So I was going through grieving menopause that I didn't, and if my girls were here today, they would tell you, you were just off your rocker. But in that days, I get sent to a menopause clinic in the Royal, because at that time we had all these clinics running, and it was her that says to me, you've actually not just been going through your mum's death, like getting over your hysterectomy and whatnot, you've actually been going through the menopause. She told me, and I was like, oh, I had no idea. I never went. I then went like that. I just thought, right, okay, I need to look into all this and find out.
So what age were you then?
48.
Oh, were you? Right.
Yeah.
Oh, and you did the menopause homeopathically, which is dead interesting as well.
I had really good books, and I've obviously, as I do with all my books, I research. I'm a Virgo. I research and research and read and take total control of that, because I didn't want. And at that point, again, going on HRT wasn't. It wasn't a thing. Like, this is all now 20 years ago. So, like, I just thought, no chance. I'll go and I'll find people. I went to Jan de Vries down in Troon. Then I went to Holland and Barrett, actually, just in Cumbernauld. Great, she's not there anymore. A fantastic young girl. Knew everything, because they actually do specialise in a lot more than what you think, and are taught a lot more. And I just had a whole
You can
load.
speak to them in Holland and Barrett about what you could take for any symptoms that you're getting.
Anything.
When I was speaking to the doctor about the blood results, which brought back this underactive thyroid, and he said there is drugs for it, I didn't opt for the drugs at this point because he said to me, the last blood test you'd done, which was years ago, it was the same. Did nobody say to you, well, no, they didn't, right? So now I'm of the opinion, because I never took my period till I was 15. I think I have had, and took us 4 years to conceive Lola. I'm now thinking that I have had this my whole life. So now to discover it at age 48, because, you know, I'm approaching perimenopausal age, I'm thinking, why would I want to take drugs with it when I've lived with it for my whole life? Yeah. And it's just now that I know the option of drugs is there, when I don't feel any different. You know, apart from like my hair, like I'm saying, I've found something for that, but I don't feel any different in myself to go down that path. Now, he did also talk about the HRT. Again, I'm open to all of that. If I get to a point where I am really feeling it, struggling, whatever, you know, touch wood, that's not where I'm at now. But if I do get to that, then I will go back to him and say, no, I'm needing something.
Yes, that's
and
what
I'm
I was going to say.
Here,
5 years down the line, you don't know. But if you know now and watch every year from now on in, oh, that's a bit different in my mood, like whatever. Oh, that's a hot sweat, whatever, that I've never had before. Be aware, write it down, keep a note of it. And see,
keep a diary of everything.
Keep a diary of it. Yep.
So, and I'm saying, I just want to say about the hormone replacement thing, you know, because I'm contradicting myself a wee bit, because everybody knows I've got a coil as well, but the coil is obviously for what's it called? Well, it was actually my periods was the reason that I got it. It is obviously contraceptive as well. The Marina coil. So I got that because my whole adult life from the age of 15 until I got that coil fitted, periods were absolutely horrific, and I could go a full 28 days and bleed every single day and only have a week off, and it'd be the same again. And that went on for years. And I was back at the doctor. I wasn't persistent, because you get fed up. You get fed up going to the doctor and saying the same thing. And I feel that there's so little known about women's hormones anyway. Not even from a gynecological point of view. There's so little known about it that unless you've got the time and energy to constantly be chatting at the door at the NHS, which, you know, resources are limited.
But the days are coming that you are going to have to, for yourself, if things are, in my eyes.
If you do need to get in, you're going to have to keep going back. But going back to the whole periods thing, so after I had Lola, it was still as horrific, and the only time I had a respite from it was when I was pregnant. But then I was sick for the whole 9 months. So, you know, But after I had her, it was just as bad, and I went back to the doctor. It was almost like one last time going, I'm so sick of having to come to the doctor about this, but I'm really fed up about this. It's driving me nuts. And he suggested, the same doctor that I'm talking about, that I've been speaking to about bloods, why don't you try the coil? And it was the best thing that happened to me. I know it doesn't work for everybody.
No.
But it is the best thing that's happened to me. I still take a period, I still bleed very, very lightly though. Nothing like what my life was like before.
Did they never check to see why you bled like that?
Ros, honestly, I can't even really remember, but I feel like I remember getting loads of different pills, like they just kept putting on, we'll try this one, then we'll try that one, we'll try this one, and you do get fed up with it. But I was going to say something else about that. The hormone thing. So the coil is a hormone coil, so I am taking partial HRT anyway. It's part of when you then become perimenopausal, the Mirena coil, and I always get these mixed up. The Mirena coil provides which hormone? Progesterone, is it?
Is it progesterone?
And so it gives me that part, but when you become perimenopausal, it's estrogen that you lose. So if I was needing HRT, it would just be estrogen that I would need. So just to make my point that I'm not...
Because I remember we got, my friend and I, we got a cream stuff and it was progesterone, and you put it onto your skin. That was another. That's brought that back as I forgot we'd done that. So it was. Aye.
So, whilst I'm saying I'm not on HRT, technically I am, because I've got the coil. So, and I like it. It's just to make my point. The HRT is totally fine and absolutely what you must do if it's going to work for you.
Absolutely.
And for me, it's all about the most important thing is your mental
health. And a lot of people need that.
The
menopause is, and if you're going through anything else on top of that, grieving, whatever, loss of job, even your kids becoming teenagers, because that's a big thing. I used to see a lot of women like
teenagers.
That.
What about
that's 10-year-olds? So that starts from that. But you imagine you're still off the health and and healthy that you can deal with that. You imagine a woman going through the menopause, elderly parents. If you've got elderly parents, they're caring for elderly parents. They've got a teenager. Fucking hormones are 10 times worse than what yours will ever be at that age. So that is really, really hard going. So if you can get help in any way, in my eyes, you take that help. You get that help.
And
that's it's a hard thing for a lot of women.
Menopause.
Parents can be parents of women, or sadly I never got that chance, but I do think, I wouldn't have my parents, but I do think, my God, if I'd have been going through that, as well as having my girls at that age and dealing with elderly parents, that's hard going. That's hard. You're exhausted. Plus trying to work. A lot of these women are working full time as well.
No, I know. I mean, there's no allowance. That's the other thing in society. There are no allowances made for female hormones. Whether you're perimenopausal, menopausal. I was hearing there's a country though. Oh, I wish I could remember. It was a couple of weeks ago. I want to say Austria, but I'm not 100% sure. Are giving women like menstrual leave. You're getting that paid menstrual leave. Totally understand that.
Totally.
Women put up with, and this is just hormones and periods we're talking about. In menopause, we haven't even touched on childbirth and pregnancy, but that's for another day, because that was another thing people asked about, that they want to see me talking about with somebody, is the whole what happens when your body goes mental in that stage. But anyway, going back to the menopause thing, am I right in saying, and this is just a general question, if there is anything wrong or not right in your body, it'll show in your blood? Is that right?
It should show in your blood. It should in one blood, because your iron could be low, your thyroid could be off, your glucose levels could be off. There could be different things that happen in that, and that is the first step that they will take. It possibly because of every blood that you get to, or anybody, if you go back and they start off with a general routine set of bloods that get done, there is limits to what they will say is borderline or whatever, depending on what the limits of the bloods are. The doctor could come back and say, no, that's okay. But you're still getting symptoms, you're still getting, so therefore further investigation has to get done. So that way your bloods might not show up, they might not be, because you could still be within a certain bracket within the periods that are acceptable
Like the
to the
spectrum.
NHS, the spectrum of the NHS guidelines on where, say it's like your full blood count, which does all your irons, your ferret, your folate, everything to do with women's troubles is all within that. So that spectrum could be, but again, like what I'm saying, like you could be borderline on that, which could be enough to knock that off, but the doctor sees that as being okay.
And that is why it's worth, if you can.
can.
Well, you're entitled to your results anyway, but if you can and want to go elsewhere, it would be a cost involved, I assume, for everybody. If you get a copy of your results, even if you get your results, it's an option that you've got to go elsewhere.
If I get them done, I sit. Well, generally it's in a face-to-face, and she'll have the results by the time I go back. And I'll sit and I know, you know
what you're looking for.
And I have an idea of what the guidelines are, where she's coming from. And if I do think it's a bit like, I get my thyroid checks, my thyroids, and I would again.
You got a low thyroid as well?
Yeah, so I'm on thyroxine. But in hindsight, when I think my thyroid went off through the menopause, right at that time,
so that's when it,
right. So and it started off that it was borderline, and I kept going back, and there was all these different symptoms. Then they did send me to the hormone clinic in the Royal.
What symptoms did you get? Do you mind me asking? Just so that
I
know, and anybody else worried about it knows what to look out for.
Probably be better asking my daughters actually, but my worst ones was anxiety, probably anxiety, and a claustrophobic, a terrible, and I remember my mum's being like that. I do remember my mum's. I don't remember, I probably did have hot flushes, but I don't remember them being like too bad. Terrible, just not, I couldn't be sitting like this, like next to you, or have anybody near me. Claustrophobia, terrible claustrophobia.
Is that to do with your neck? Like
feeling
the pressure on, because your thyroid sits in your neck.
Because your thyroid is sitting there as well, so it was all a mixture of, just all the feelings, the hot flushes, the insecurities, the anxiety, everything that you feel.
And it was a big difference to what you were like before, and that's how you knew. Do you know what I mean? That was a big change to your whole.
Well, I never really knew, because at the same time I was grieving. I'd lost my mother, and that wasn't expected to happen. So I did know after I had the hysterectomy and they kept my ovaries, they did say to me, you're going to go through the menopause much sooner. And I just thought, all right, fine. I was quite ignorant to all this. I wasn't working in the NHS then, so I didn't really know what was going on then. I was working in an office, working full time, had the two girls who were also grieving for their gran that they were very close to. So there was all sorts happening then. I just knew I was being pretty lunatic about everything. And
see, I don't know if I would know, judging on that about me, because I'm a bit of a mad old enemy.
I didn't know, because I was quite like that. So I drank quite a bit then, and smoked as well.
Did you? Would never have known that.
No, because it was just like horrendous stuff. My husband was away a lot. I had the two girls, I was trying to keep them, but I never really actually, because I was just in this whole grieving thing and actually that's when. So eventually I got to that clinic, got that, also took all these different breast things that had to go for all this, and so they wouldn't put me on HRT anyway, because they were like.
So you went through menopause and you didn't even know it until after it.
Until after it, I never had
You see, and it's worth saying that as well. I know loads and loads and loads of women suffer with menopause, but it is worth saying that there is a percentage of women that don't get all the horrendous symptoms. It is worth saying that, because if I am perimenopausal, I hope that I am, because the only thing that that could be contributing to, symptoms is my hair, albeit we know that I've got an underactive thyroid. But how do you really know that that's what it is?
Yeah.
It could be the underactive thyroid, but I think I've had that my whole life. So is it a combination of perimenopause and underactive thyroid, or is it just perimenopause?
Which
you
goes
don't know.
with it. And also your B12 can go off then, which causes anemia, which comes up in your full blood count because your iron levels all go down.
Aye.
So then before you know it, you're struggling with all this. I had no energy. I went to Holland. My sister was just moving house then as well with all this going on. And I went to Holland over to Hurst, which is my wee safe haven. And I was just like, I can't even go on. I had no energy whatsoever. That was a big thing. And it was when I came back from that they sent me to that clinic, and she said, you are actually going through the menopause. I can't even remember. I couldn't tell you
at the
truthfully.
time. Aye.
And even, how did you know it? Like, did you do bloods, whatever? I just knew my thyroid was off. I was going through the menopause, no idea. And I thought, right, I also went to a spiritual healer after that, because by this time I had 2 wee girls. One just started high school, another one was a teenager. And I thought, I need to change my outlook here. I need to change. This is enough for us all. And I thought, right, I'm doing this spiritually. I'm doing this homeopathically. I was too frightened to do anything else. Plus I couldn't get on HRT anyway because of the breast lumps, which were all okay. So I basically just studied it all. Studied. And I'm glad I'd done that.
Aye,
I had a whole load. I couldn't even tell you. In fact, I actually even remember one of my aunts, like months later, give me a list of all them that you took. I mean, I had a wee thing, and I had maybe about 6 different homeopathic tablets that I got from Holland and Barrett through here. And a great girl that worked up there. She was, I can't remember if she was the manager or not. I think she was. And she left after that, and I thought, my God, she just knew her stuff. She just knew her stuff.
It's worth knowing that, because I would never even think to ask somebody in Holland.
Oh my God,
Barrett.
no.
I know, and that's terrible.
I would never. To be fair, I don't know now, because when I go in now, like, I know what I'm looking for, and I know what I've still carried on and what I still take. So I don't know, and I don't know the girls up there now that you used to know, and I don't know if they know as much as what the girls used to do. I think I would run it past them.
Aye.
And see, you'll know yourself whether or not.
I'll be honest, I'm with you. If there's anything wrong with me personally, it's the spiritual side and I'm quite happy to openly say it, that I turn to first. I think when drugs or hormones or whatever are involved, I always personally feel like that's my final resort. I've tried everything else. I had tried taking other supplements before I even phoned the doctor, and nothing was working, and that was why I phoned them. And like I say, if I need to go on HRT, I will. But I'm like you, because I've lived with anxiety since I was 4.5. I have always found the meditation, the spiritual healing side of it has benefited me way more, especially mental health wise, than anything else. And that's just my view. I'm not saying that's how everybody should do it, but that is what's worked for me.
I think for anybody now, and my patients that came in fact, some of my patients that came in, and that's how I found out, and it was through a patient, because she was like, check my thyroid if you like. And I said, well, I'm only doing what the doctors asked me to do, hen. I just don't really. And I had a great rapport. I had good patients, absolutely no problem whatsoever, because I worked with them. And I told them as much, go back. Don't go back to that doctor. Go back to that doctor. Try that doctor, because a second opinion is always worth it, and you are entitled to that. Never mind that they roll their eyes at you, or they tit, or whatever, or your doctor's impatient with you. Try and bypass that. Try and bypass that.
And it's not about being aggressive either. It's just about
because there's a lot
standing your ground and saying, I need to speak to somebody.
There is good doctors, maybe not everybody, and I know because I'm not into all that, but there's maybe, I know good doctors. I've worked with them. There is people, women doctors that are interested. It's getting that doctor that can help you, and women health problems.
No, I would agree with you.
It's-
The lady, and it turns out you know her, the lady,
Yes.
the doctor that put in my coil was incredible.
Oh,
To the
yes.
point I was thinking, this is a bit weird that I'm getting so much information and conversation and questions from this doctor, because I'll be honest, in my experience, that's not what I've had from going to a doctor. You know, she isn't my doctor.
No,
Well,
she's just
more practice,
she's
I
not-
should say. She
she's
was
not-
just the clinic that I went to get the coil fitted. But in terms of like menopause then, Ros, right? In your opinion, and this is just your opinion, where do you, and I know you'll not want to say anything wrong, you don't need to, but as a society in Scotland, because this is where we are, how much do they really know? What is really understood about it? Hormones and menopause and women's issues in general, even before menopause, periods and, you know, issues with that.
I think if you get the right doctor, and a lot of these young doctors, not your GP needs to be seen as your GP. Look at it as a general practitioner. That is what that doctor is. They might have looked into, if you've got a women doctor, they might have looked into a bit of women's health, a wee bit more than what another GP would, and it could be another female. But, and also you've got good males. I mean, that's not one of our doctors, the male is is good for women's health, that you can go to him. But there is good GPs out there, or not GPs, sorry, good consultants, and you are entitled to go to somebody else. I know now from that, I mean, that was a great clinic, that hormonal clinic, and I know there's not that, but you can be seen by who you've seen. Like now they're umbrellaed under the one, actually all comes under sexual health, all the clinics.
Aye, that
now,
was where
although
I
it's
went.
not-
It was the sexual health clinic that I went to for
to-
my
yeah,
coil.
yeah,
That
it
was
is.
where
So
I
it
went.
all, so it covers now. That all used to be separate. Now it's all under the one umbrella. All the doctors, and there's a lot of advanced nurse practitioners who are very good nurses. That, so if you were just getting, am I allowed to say this? Like about what? Like whether you were going to get it in and out, or whether you were just going to get it in.
Aye.
So if you were just getting it out, you were going to be seen by one of our nurses, the nurse practitioner, an advanced nurse practitioner who studied that bit of women's health. Because you were getting it out and getting it in, you then had to go under the doctor to see that.
Right.
But these girls are all, and you can ask, that's not going through your GP, you can do that yourself.
Oh, can you?
Go-
Right, so this is what we need to
Go
tell
to-
people. So if
go
you're
to-
not happy, sorry, just to
Yeah,
get this right, if you're not happy, you've got a women's issue, hormones,
Yeah.
periods, menopause related, and you're not happy with the doctor saying to you, there's nothing wrong with you, everything's coming back normal, go home. How do you get to go and
Look
get in
up
front of
sexual
somebody?
health. Look up sexual
So you
health.
can Google
so sexual
health
North
in
Lanarkshire
your-
sexual
North-
health.
Right, and it'll come up with a
It
clinic.
might be like you that, well, obviously we kind of sorted that out, but you know, it might be that it couldn't, like for you to get that appointment, they were like you were prepared to go anywhere. So it could be that clinic, there is clinics. So that was Cumbernauld, that was a Monday
Aye,
night.
it was
I
the
used to work at
central.
that clinic. There was one in a Friday morning I used to work at when I worked in North Lanarkshire. So there is clinics, but there's clinics in Coatbridge, Airdrie, Hamilton,
Anywhere you live in
anywhere in North
Scotland.
Lanarkshire, sexual health clinics. And don't be put off because it goes under sexual health. The other thing about it is it will ask you I would imagine you were asked quite personal
Oh, aye,
questions
they
about
ask when
your-
you last had sex,
Yes,
and
and
you
yes.
know, you're like,
Right.
oh, do you really
So-
need to know that?
Yeah, I know. Right, so at one point that wouldn't have been. Now the umbrella is that you are under, and it's not going to take you like under sexual health, but you've got to think that some wee lassies are going in there from abusive relationships.
Oh, yeah.
From mental.
Aye, it's
so
very
they need to now
mixed.
ask, are you in a relationship?
Yeah, I got asked that.
Yes.
It's funny you should say that. I did get asked that.
You
I
will
got
get
asked
asked.
how long I'd been with my husband. And the
Are
lady
you
that spoke
happy
to me,
in your
she
relationship?
asked me if I was ever exposed to
To
domestic violence, and I
yep.
thought that was amazing.
Yes.
That they were asking that, but I
Yep.
didn't realise she was kind of meaning, like, you know, recently or whatever.
Yep.
Because I was like, well, I was when I was 4.5.
But do not, if anybody's
fanny.
on here that, you know, you don't
Aye.
know that
So,
somebody and they're not
yes.
saying that are in that position, please do not be taken away from that, because it is all very, very confidential. I cannot tell you that enough. It doesn't even go by your name and your date of birth. You are an anonymous number. I don't know if anybody's been to a sexual health clinic. I would imagine probably you have been at some point, but anybody that's thinking, oh, fuck that, I'm not going to that clinic, because, you know, it is very...
I'll be honest, I felt like that. I was thinking, I'm going to a sexual health clinic here, and it comes
I should
with
have said that to you.
Well, I
but
did the last time. I don't know why it bothered me this
right.
time. That was the same clinic I went to for my first
I
coil.
know.
They don't do it in the surgery.
No.
So
I know.
I was thinking that though this time, going, I'm getting into this sexual health clinic. It's, you know, it's shrouded with a reputation of, wink, wink, nudge, nudge. We all know the type of people that go in there. But we need to get away from that, because... That's we all need to take care of sexual health.
It could be that you are sitting in the waiting room, like where you were, but there's different. You would never know whether a person's there to be seen for an STD, a coil,
the pill, condoms,
just
everything. You can go there for that as well.
Yeah.
And it's
kind
all
of like
free.
If you know the Sandyford Clinic in Glasgow.
I don't, but there will be
women's
people
health.
that will know.
So that's run the same. You can also go there if you've got any.
Right, so am I right in saying you can just Google your local sexual health clinic, and if it's because you're having problems with your periods or menopause or anything like that, you can
get. You had the number. I can get the number. If anybody
you can
wants
Google
it privately, or Google it
I'll be
yourself.
tagging you. Anyway. So, you can't, right, I didn't know that. So, I only knew that I needed my coil changed, and you helped me, you know the right person to go to and phone and whatever. I did not know that you could phone these clinics with
these
hormonal
clinics,
and take advice from there.
And also, if you go, like the doctor that you went to, if she doesn't know, if you're going for something, so say she actually, because although you would be getting that coil, and she's also doing checks, right? You're getting a swab done, then you'll get your she's saying your smear that you've needed. So if there's anything at all, so say, and I know you problems, which I says to you, look, you've had that in a long time, that's got to come out, and it's not. I had it in for over 6 years, so it's not the easiest of things. But they will also take you, and if you need, if there was something like, no, I'm not happy with that, they'll send you to a gynae, you know, they'll scan you, they'll send you
they
to...
refer you.
So it doesn't need to be from your doctor, and that's what I'm saying.
Right, I was going to ask that.
You don't just go to your doctor and just, well, no, that's as much as I can take you. Doctors are extremely, and I know there'll be a whole mixed thing about doctors, or what you feel about doctors or receptionists, but in my eyes, they're working as hard and doing the best that they can. Like every profession in life,
there's good and bad in every profession,
right?
No, I agree
so
with
take that. But you go to a clinic like that and come back and tell me that you've not had decent help, proceed whatever,
information
and advice, and I would be totally shocked, and that's the God's honest
truth.
truth.
In my experience, I can vouch for that as well. The 2 times that I have been for
These
the coil,
girls,
6 years ago and just the other week, it was the service. Is that the right word to say? It sounds so,
you know, it's not even procedure. I can't think.
The care and attention has always been excellent, not just by the doctor, but by the nurses or the assistants or whatever they're called. That's helping.
I have worked in them all. I've done the STD clinics, sexual health clinics when it was sexual health. I've done the family planning clinics. I've done and really, honestly, my hat's off to them all. They are more than interested in your health and what you are. It has got deeper now because, again, and I haven't done them through COVID because obviously I was just doing my bloods then, but I would imagine probably through COVID there was a lot more girls and things going on. The other thing I will say as well, it's come in there is a couple of guys, men, doctors that do the sexual health clinics, but you can ask. to know if you are in any way uncomfortable with
You can
it.
ask for a
It might
female.
be it's better for a guy if he's going, because he should be getting checked just the same as.
I'm sure it was
You're
a guy
getting
that
checked.
put my first coil in. I'm certain it.
I'll
But,
tell you later.
it was
I'm
a
sure
male
it is.
consultant
And
I had when I was delivering Lola, so for me personally,
no,
it does
that's no.
help yourself.
Exactly.
You know, I'm not
Once you've had
bothered.
kids, you're not.
But,
But there could
aye.
be people or younger people that
maybe, but,
everybody from whatever age, again, it's a responsibility on you, should be at least, I would say, once a year getting a sexual health check.
Oh, really?
Oh, aye, absolutely.
So do
if you're
that anyway.
single, or you be responsible for your body, you be responsible. Maybe a year's totally out now. They're probably them the doctors watching and going, Roslyn, what you saying? But no,
But you
no.
think you should
I'd
get
push it. I didn't really, because I only knew that when I started working in the clinics, and I was like, oh my God, does this actually go on in life? I loved it because it was an area of, I was only doing the nursing assistant with the doctor, but it was an area that opened my eyes. And I went backstage to my girls, checks that, but they were like, Mum, we've been. So, and you want that. You want that for Lola when she's that age. You want that.
No, I agree.
You're not going to stop these kids.
I'll take her.
Oh, absolutely.
Aye.
Absolutely.
No, I agree with that. And the thing is, you
And it doesn't
can't.
mean so if she's like, at her day you had to go to the doctor that was your family doctor. So no, you take her to that, or you know, go to that way. And if it is, they'll say, when you're making the appointment, they'll say, oh, it's whatever doctor so and so that's on, it's a male doctor. If you don't want the male doctor, then get another
Ask for a
appointment.
female doctor.
It is not, absolutely not a problem. Like every other clinic and everything that's going on now, they are busy. You'll know that.
I know, I did know there was a waiting list. So you don't need to, so just to be absolutely clear, you don't need to go to your doctor, your GP, if it's hormonal female issues.
Your doctor
can go
will
straight,
get a note of what you've been. Like
but
your
it's
coil
fine to
would
do
go
that.
into your notes.
But it's fine to do that, to go directly to the sexual health clinic in your local authority area.
In your yep, absolutely.
Well, I think that's a massive help. I'm not really sure what else we can cover that we've not covered in terms of women's hormones without getting really specific, which we can't do because neither of us are qualified. It's
no,
just a general information thing.
I'm just giving you my insight as to how the clinics were run. And the same with going to get bloods. Find out the amount of people that came in, and I know COVID, it was just bloods after bloods after bloods because it was all they could do because they weren't seeing people, but the amount of people that would come in and say, what am I getting these bloods done for, hen? Blew me away. Because if you know nothing else, at least know what comes with a routine set of bloods. Know why you're getting that routine set of bloods. That's all. You're not, and if your doctor's irritated or receptionist is irritated by you asking that, that's too bad.
Aye.
But find that out, if nothing else. And if they do come back, 9 times out of 10, they will be fine. They will be okay, and you don't need to find anything further unless you're still having, well, I'm still getting, is there any chance that they're borderline or whatever? Then, but go back to your doctor. Don't go back to your receptionist. Just say, can I have a telephone consultation with my doctor? I would like to look into this a wee bit further.
So there is two things here. You can either go straight to the sexual health clinic and get an appointment with them, or you can go to your doctor, get an appointment with them. But regardless of who does the bloods, whether it's in the sexual health clinic or in your doctor, make sure you're asking, what am I getting checked? Or even when the results come back, what was checked? So just to know, or even get a copy of them, which you're perfectly entitled to.
Now, another last wee bit I'm going to finish on is it time?
Aye, Belle.
Is another wee bit is that if you do go to any of these clinics or anything, I'm going to put it out there professionally wise now, whether it's a lawyer, whatever professional, right, policeman, whatever, and you find that that person is taking on your case or is interested in what you're doing, get their name. Get their name and follow it through with that person. Because all these things now, people now are all exceptionally busy people. So rather than you having to go back and not get that person and go over that conversation
Process.
again. Yep. Find out, get that one person and wait for that one person again. I could not tell my patients that enough, whether it was a doctor or whether we spoke about other
You
things.
can ask
out
to
with-
see specific people. If
Yes.
you meet somebody in any profession
profession.
that you get a brilliant rapport
rapport
going
with,
with,
yes.
relationship,
Marriage,
and you want to
so-
keep it,
yes.
yeah, you can ask for
Yeah.
that person
Yeah.
again as
Yeah,
well.
I
So
remember
that's-
speaking to doctors, consultants about my mum, and I knew nothing about the NHS then. And I just knew that I'm going to him. I trust him. You have an instinct. You will know who you want to trust. Whatever. I've had it with lawyers. I've been to lawyers. I've kept to that same lawyer and never change anything like that. You get and write down. Write down, even if it's on the phone, write down that person. Even if it comes to receptionist, you think, oh God, there she's back on and I'm too nervous about that. Hang up and then get another receptionist and say to that other
Phone
receptionist,
back.
what's your phone back?
What's your
What's
name?
your name?
And ask for that person.
Take it. Don't let people, there's mental health. No, you're not going to get any better if we don't do that thing for ourselves. And it's a bit that we can take for ourselves because we've got that power.
Aye.
You have got that power to be able to do that.
Taking responsibility,
Taking responsibility.
for who your relationship is
you-
going to be with
yes.
to get the best results,
Results,
which
yes.
ultimately that's what
That's what I
everybody's
want.
after.
Yeah.
Okie dokes. Thank you so much,
You're
Ros. It's
welcome.
been a pleasure. I hope everybody gets something from
From
that.
it.
We'll
I
speak
hope
to you
so.
next time, hen. Bye.
Bye.